Hello, this is Stacy Bell with Northwest Arkansas Community Parent Resource Center. I'm going to talk to you about assistive technology funding tips today for our Fact Friday. The first thing you want to do is get an assessment. A lot of funding sources require documented proof of your need for the equipment or services that you're requesting. An appropriately certified professional, such as a doctor or therapist, can provide this. They can also help determine which particular devices and services are right. So it's very important to get an assessment. Number 2 is to keep accurate records. I know there's so many different things to keep track of, but it's really important to write down any disability-related services that you received and to keep all of your documents related to the disability. Also, make sure you keep records of all the phone conversations and contacts that you also have. Number 3 is to know the main purpose of the device that you need. Is it a medical necessity, a tool for education, or a way to hold a job? The answer to the question will help you determine the best funding source. Number 4 is file your application as soon as possible. If you think you're eligible for services from a program, contact the agency's local office to start the application process. Number 5 is provide complete information. Gather all the necessary information in detail. Answer questions directly and completely. Use the same terms given in explanations and questions to save time and get a quicker response. Number 6 is to keep close attention to the progress of your application. You need to follow up with phone calls and make sure that your application is being given attention. Don't hesitate to ask questions along the way. This is number 7. When you're in doubt about something, have your question answered before you go further. For number 8, you need to encourage communication between agencies. If you find yourself talking to representatives from different agencies, ask them to talk directly to each other to find out where different policies and procedures can be used to your benefit. And finally, number 9 is if your request is denied, find out why. You should strongly consider appealing a negative decision and providing all additional information or making necessary changes to the application. Now I want to talk to you about funding options. The first option you have is private insurance plans. Those plans and policies often do not contain information about exactly what technology and services are covered, but this does not mean that the company will not pay for all or part of the service or device. Sometimes it's important to show that the assistive technology will improve the condition, but approach your private insurance first, and other funding sources may require a rejection from your insurance company. Number 2 is Medicaid is a joint and federal state program that pays for medical and health services to people with low income. Assistive technology devices must respond specifically to medical problems and be prescribed by a physician. If private insurance covers a medical service, Medicaid will not pay for those services. Most assistive technology devices are funded under the durable medical equipment or prosthetics categories. Most assistive technology services are funded under the therapy category. You need prior authorization from a Medicaid provider before purchasing a device or receiving a service through that provider. The third one is Medicare is available for people over age 65 and people with disabilities under age 65 who have been entitled to receive Social Security disability benefits for 24 months. The scope of coverage for devices is limited. Durable medical equipment and services must be used at home, be medically necessary, and be prescribed by a doctor. The fourth option is school districts may purchase technology devices for your child. However, if a school district purchases the equipment, then it's owned by the district, so you don't actually get to keep it. And then finally, state agencies such as Vocational Rehabilitation Department and or the Department of Disabilities may offer services and pay for devices. but you'll need to call and see if you're eligible for their services. So those are just some really general tips and funding options provided by South Carolina Assistive Technology Program. Hopefully these things were useful to you. If not, if you need more information, feel free to give us a call or go to our website to get more assistance. Thank you.